Labour's Wes Streeting claims wasteful NHS are using the winter crisis as an excuse for cash. I'm going to read into this more from the Independent, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is REGANELITE here with an article from the Independent with the headline that Labour's Wes Streeting claims wasteful NHS are using the winter crisis as an excuse for cash. The Shadow Health Secretary is accused of undermining trust in the health service, but he insists the public must hear the truth. This isn't the truth. The truth, here's the absolute truth from, I have to say, what is absolutely dumb comments from the Shadow Health Secretary. Because if he actually put his brain in and actually paid attention, he would know that there's a lot of the funding that going into the NHS that goes from the government's purse into the NHS. It's in fact going in straight into the hands of private companies, private companies that have their hands in the NHS. A lot of the NHS, the vast majority of it, has been privatised. And what do private companies prioritise more than anything? Profit, margin, money. That's what that's their thinking behind it. And for the last 13, I say 13 years, but for a long time, doctors, nurses, people working in the NHS have not been given a reasonable pay rise. And and you can throw a lot of money into the NHS, but the fundamental problem of it is that we have too much of private ownership in it, and we don't have enough staff as well. Since Brexit as well, we have lost a lot of members of the National Healthcare Service. Many of those doctors and nurses and workers used to come from Europe, and we don't have them that we have anymore as well. So there's a number of these things that are playing into it. Now, him claiming that the NHS are wasteful, this is not because this is primarily down to what the Conservatives have done to our national healthcare services. If he had any inkling of a brain, he would have known that the healthcare service was deemed one of the best on the planet before the Conservatives took over back in 2010. So I just think that this is an attack on the National Healthcare Service, and I feel like that he is trying to advocate more of it feels like he's bashing the NHS, and it's like, dude, like how dare you? Like, you know, do you have any idea what's going on here? And I just find this really, really insulting from Wes Streeting, because the NHS are already getting an earful from members of the public who are misinformed, by certain sections of the media who are painting it that the NHS is failing, and more every day people are talking in politics about privatisation, creating a two-tier system for healthcare, you know, and they want to take away what the NHS is, you know, a healthcare system there for everyone. The other point as well, and I'm sure people are going to argue, is that we shouldn't be that the healthcare should not be used for people who aren't British, as well. And I would say like that's not the reason why the NHS is in the place it is. It is underfunded. It has been underfunded for 13 damn years. Now you hear the government saying that they've record investment, yeah, but like I said, a lot of that money goes straight into private companies. It doesn't even go into the NHS. It gets funneled through the NHS to these companies and shareholders, American healthcare companies. Yeah, you want to know what it's like to have American healthcare? Go ask some Americans what it's like, yeah, for them to pay $6,000, yeah, for cancer treatment, because that's the path we're going down. If we have idiots like these making comments like this. If you want to pay out of your own pocket for healthcare, go private. Yeah, would you want to do that, or would you rather not have to pay to be looked after when you are in need of serious ill health? You know, because that's really important here. So let's read more into what this dummy had to say. So the Labour Shadow Health Secretary Wes Streeting accused the wasteful NHS of using repeated winter crisis as an excuse to ask for more money. Again, he's not been paying attention to the last 13 years. The key figure in Sir Keir Starmer's shadow cabinet said the public needed to hear the truth about the NHS, promising a tough love approach to running the health service. Mr Streeting vowed to shake the NHS and the public out of complacency over the British healthcare, and he pledges to bring back a family doctor system as part of Labour's wide-ranging reforms. I think people working in the NHS and the practice using the NHS can see examples of waste and inefficiency, he told the Sunday Times in a visit to Singapore. In an outspoken attack on the health service bosses, Mr Street, and I don't think it's good enough that the NHS uses every winter crisis and every challenge is facing as an excuse for ask for more money. If it was funded correctly, if it was managed properly, if the people there were paid effectively, if these things would not be happening. So again, I don't buy what he's saying at all. The frontbencher said the NHS is not the envy of the world and is not delivering the quality of care that any of us wants, and unless it changes, it's not going to survive. Nobody's arguing that it needs to change. It does need to change. That is inevitable. It does need to change. But we also have to remember why it's in this position in the first place. I have to stress that the reason why is because of what the Conservative Party have done to the NHS over the last 13 years. It's very important to stress that. The leading NHS campaigner, Dr Rachel Clarke, fired back at Mr Streeting, accusing him of quite openly and deliberately undermining public trust in the NHS. That's exactly what he's done. He said that the senior Labour MP claimed that the health service used crises to ask for cash was the most massive kick in the guts for the NHS staff, and added that he was using the problem as a political football. Exactly. He's using it he's using it as a political football, and it's wrong. Dr Clarke tweeted, "Do you have any idea how hellish it is to work in an NHS and an AE over winter? How much staff is given to those horrific conditions? How dare you insinuate that somehow using those conditions for their own ends? Show some respect, please." Mr Streeting insisted that NHS bosses were going to have to get used to the fact that money is tight. Even if Labour wins power next year, we would have to get used to switching spending, rethink and where and how care is delivered. He said that he would give managers freedom to initiate and create as long as they deliver, adding, "That's the tough love that people can look forward to if I become the Health and Social Care Secretary." Visiting Singapore General Hospital, Mr Streeting said he was impressed by a system that was designed around patients. He said Labour would bring back a family doctor system as part of key changes. The irony is that in Singapore we have a government that is seeking to move towards a family doctor relationship. In the UK we've got a Conservative government that moved our country away from it because we don't have enough GPs, he claimed. Mr Streeting added the NHS is perfectly capable of arranging appointments in a way that maximises the convenience of patients. It just often chooses not to, or the system isn't wired to think about it. The Shadow Health Secretary said NHS patients should get more power to swap GPs using the NHS app. I do agree that more needs to be done to encourage people to use online services as a means to help keep the numbers down in hospitals, and that is something that I do agree with. Excuse me. And Mr Streeting said he wanted to see something like Singapore Health app, which lets patients link up their hospital and GP services as well as addressing their medical records. "I'm really interested in exploring this approach," Mr Streeting said. Yeah, but what I don't like is that an American spy firm having control of our NHS data. That's what I don't like. If you didn't know, yeah, Platinum, a American spy firm, are going to be won the right for a contract of basically going to be building a system that will hold all our NHS data. Yeah. The Labour front page also suggested he would be happy to listen to GPs about dropping some of the government's targets in a bid to free up their time. "If you're measuring 55 things, you're not really measuring anything at all. Let's get rid of the stupid stuff that is holding the system back," he said. Sir Keir has previously said the ineffectiveness in the NHS created a mind-boggling waste of time, and that he wanted to allow patients to be able to bypass GPs and refer to themselves as specialists. But the British Medical Association said Labour didn't understand the vital role of GPs, while Dr Clarke called the proposals monumentally stupid. The Labour leader and the Shadow Chancellor Rachel Reeves have both warned that there will be no big government checkbooks to save the NHS, insisting that major reforms are needed in the way that it is run. Like I said, yes, reform is needed. I'm not debating the point of reform. What I'm debating is what he is saying about saying that they are wasting money. They are not specifically wasting money, okay? They are not specifically wasting money. And as she rightly pointed out in hitting back, like, you have no idea what they are going through. And I think the comments are extremely insulting. It's a very hard time, the winter crisis for them, and of course, we can't splash the cash. I get this whole splashing the cash, but what they need to do is they need to take more of the private sector out of the NHS and get it back into state hands. If they don't do that, then we're gonna keep having this problem, and they need to make it easier for people to come and work. For people from Europe to come and work for our national healthcare service, because we relied on a lot of workers, lots of doctors and nurses from abroad to run our NHS, to help be a part of our national healthcare service. We don't have enough in our own country. We just don't have enough. We need more staff, okay, and we need to give a fair pay, to those who are striking as well. Fair pay to them as well. And yes, that is going to cost money. Nobody's going to. I'm not arguing that, but they need to be given fair and reasonable pay, and it has to be proportionate as well. But him spiting, calling the NHS wasteful, it's so inhumane, and he's clearly not seeing the bigger picture here. He's clearly not seeing what's going on. And like I said, I think it's just a political insult to appease certain people of the right wing who believe that the NHS has failed them, that it's letting them down, when in fact it is the government and its policies around how the NHS is funded, around how the NHS does things, is what's truly letting it down. And it's very important to make that distinction, guys. So what do you make of Wes Streeting's comments? Do you think the NHS is wasteful with its money? Do you believe that perhaps if we weren't investing so much in private healthcare, that money wasn't being funneled through, things would be different? Do you not agree with me that people working for the NHS should be given a decent fair pay? They've not had a real term pay rise in over a decade, guys. So is it not time that they have been worth one? Let me know in the comment section down below what you guys think. Hit the like button, be greatly appreciated. Share this across social media, and hit that bell notification icon so you'll be notified when I upload another video. And if you want to financially support me, you can do so by buying me a coffee or joining me on Patreon. Thanks so much for watching, and I hope to catch you all very, very soon.